Thank all of you for coming. Congressman Zinke, what's the price tag that you're talking about to get the funding back?
Well, great question. And again, we couldn't get a CBO score. The best we can analyze it is that they're spending about $200 million across the board on ambulance services between air and ground
Per year?
Per year. But again, this is no cost savings, because the issue is, and the reason why the CBO had the problem, one is that the PACT Act, they looked at it, and it needs a lot of work on what's discretionary, what's non-discretionary. Remember that one? And then the HHS has not updated the ambulance rates since 1998. And then the VA said they would do a contract. So when the CBO score was looked at, they were unable to determine real savings because the rule's not implemented yet. So we couldn't get a CBO score, and that's part of the problem. And I would look at this is that it's being conducted now. The solution is to do what the VA promised they would do, to enter into contracts so they could take distances and platforms and all those things in consideration, rather than doing an old form that just doesn't work. So I would love to say this is a CBO score. We've been working with them, and they're unable to give us a score. So then you go back to what was the original deal is to keep VA whole, and look at where we want to make sure emergency services in the VA are critical, and this is one of them. And that's the best I can do.
Yeah, I can't imagine that was ever cut. I really can't, for any state, Montana or anything else, any other state.
Well, and it's just not Montana, it's across the Oregon. This is bipartisan, so it has bipartisan group because it affects all veterans. But also, when you're looking at platforms, when Montana has so few people and most of the recipients are on Medicare, Medicaid, Indian Health Service, this applies, the air service applies to everybody. You got to get them there, and all of a sudden 911 calls are not allowed. What is allowed? This is a big problem.
Congressman Mast, if I understood your testimony, you're wanting treatment for to get off the drugs veterans are under. Did I understand that right?
My friend, what I would say, in my experience, a number of my veteran friends have utilized cannabis as an alternative form of medication very successfully and without the same detriment to their families, and it's really allowed them to go back and flourish within society. I wouldn't pretend to say which veterans it's good for, which veterans it's bad for their health, for their psyche, for anything. I could absolutely point to individual cases of friends that have, as I said, flourished, but the system right now as it stands in states that have cannabis programs, doctors within the VA are not allowed to, per the policy, stating that VHA providers are prohibited from completing forms or registering veterans for participation in state-approved marijuana programs. They are not allowed to have essentially honest conversations with their patients about whether it even is or is not a good option with their patients.
That's amazing. That's not allowed. I mean, it really is. Very few people know that, I think.
I find that as well.
Thank you for bringing it up.
And, Mr. Chairman, for the record, you asked a question about savings. The VA estimates, if they go non-contract, they'll save about $40 million a year. Is what the total program is about 200. They say by implementing this rule, their savings would be $40 million. But also that savings wasn't represented in the president's budget. So the the VA budget that was sent to us, it was whole. So this is a rule that even affects the president's budget.
Okay. Thank you. I yield back.